Good evening, everyone. As COVID-19 continues to evolve, the virus is shining some light on healthcare and racial disparities.
Last week, Governor Edwards created a task force aimed at educating at-risk minority communities and researching how to address underlying health gaps between blacks and whites here in Louisiana. Blacks account for 1/3 of Louisiana's population, but they represent nearly 60% of the state's deaths from COVID-19. In Lafayette Parish, the African-American population mirrors that of the state. So far in Acadiana, data has not been released breaking down racial impacts of the coronavirus. Chris Welty joining us live from LCG to explain how Lafayette leaders plan to close the gap. Chris.
Lafayette Consolidated Government created the COVID-19 Health Equity Task Force. They're looking to expand testing for the high-risk community and as they work to solve inequities. In response to the data on racial disparities, LCG is expanding testing sites, including those with rapid reads. Carlos Harvin is LCG's Chief of Minority Affairs.
Altogether, 16 testing sites that are available in Lafayette Parish. Of those 16, 6 of them are located within the proximity of District 1 and District 5. Those two districts have the highest proportion of African Americans living in Lafayette Parish.
One of those 6 clinics is the Northside Community Health Center. They're still ramping up supplies before testing begins in the next week or two. They plan to even use their mobile health clinic to reach those who don't have the means of getting to one of the other clinics.
When we come to your community, we want you to come out and get tested if you have a legitimate concern and you do need that test, whether you can pay for it or not, whether you have insurance or not, because we're going to take care of you. That's our mission, that's our mandate, that's what we're going to do.
Radio host and former Lafayette City Parish Councilman Kenneth Boudreaux agrees access to testing is key. He's been vocal on his show, warning his listeners about COVID and questions why the mayor-president did not address this part of the population sooner.
I think he could certainly do more for the African-American community, and I reached out to some local officials asking them to consider additional sites, and I immediately said that there's going to be a need for a site in North Lafayette. I was telling my community in particular, but everyone as a whole, don't sleep on this issue because African Americans always ends up on the top of the bad list.
Though Boudreaux would like to have clinics open in public spaces on the north side, LCG says community partners are stepping up now that there is more research.
And so for these people in these communities that typically are not able to get out on just a normal day without a coronavirus pandemic, we have to reach out to those vulnerable populations and communities and try to take care of them the best way we can.
Harvin says LCG is looking for long-term solutions.
That means changes of lifestyle, because we know if we reduce those numbers, we reduce the likelihood that there could be a second wave. We'll be in a much better position for this or any other virus that could come down the road.
This afternoon, we asked Mayor President Josh Guillory why a location wasn't opened on the north side prior to this, and he said that the Cajun Dome really was a central location for screening and testing in Lafayette Parish. He also added that we didn't have the data showing the impact that it's having on the African American community until about a week and a half ago. Live in Lafayette, Chris Welty, KATC TV3.